that. All right. So we will go ahead and like I said, we're gonna go ahead and take quiz 4. So Jasmine and um Kira, if you could hop on camera for me, that would be awesome. Kira, are you there? There you. All right, awesome. Oh, we lost Miss Bruni. There she is. All right, perfect. Just give Miss Johnson a minute and then we will get started. Did everybody have a good week? Good.
Yes, for the most part. What about you?
Awesome. Um, all right, so there we go. All right, some reason. Sorry, guys, for some reason, the waiting room was not alerting me, so I apologize if you were waiting. Thanks for emailing me, Heather, because I was like, you guys were not populating in the little thing, so. All right. So, like I was saying, I'm still waiting for one person to get on camera, but for tonight, we're going to talk about occupational health. We're going to talk about environmental health, barriers to learning with client teaching, and then health education and health prevention when we look at education. So go ahead and take the quiz. Um, it is 10 questions. You have 15 minutes to take the quiz, and I'm going to adjust the time because I already know that this was an issue last time. And let's just do this because I don't remember what happened last time. So we'll just do that. All right. So your quiz is ready. I'm going to change this. And the password is in the chat. Again, 10 questions, 15 minutes. Take a break when we are done. And whenever the last person is done, I'll add 10 minutes and that's when we'll start lecture. All right, you guys did really good on the quiz. Good job. Does anybody have any questions? No. All right.
No, ma'am, no questions.
I'm just pulling up, I'm gonna pull up the PowerPoint. All right, so again, the topics are occupational health, environmental health, barriers to learning, and then reinforcing health education. So the readings are, you're in your fundamentals book, it's chapter 6 and chapters 9. And then of course in your course module, if you look under module 6, there is a little bit of reading about the topics for today. So be sure that, you go back and you kind of look at those. So I will share my screen so you guys can see the PowerPoint. All right, so did anybody take a look at the readings for this week? All right, so we will start with occupational health. Has anybody heard of occupational health before? Anybody working in a place where occupational health is part of their organization? It's not just nursing. There are other companies that employ occupational health nurses, providers, that kind of thing. So occupational health is a specialty practice that delivers health and safety programs and services to workers, to the worker population, community groups. And we know that no matter where you work, right, there's associated risks. And so that is the goal, right, to promote health and prevent occupational illness and injury. And so they can do improvement as well as maintenance of health. They can look at workplace expenditures. And by doing everything that they do, it helps to decrease the chance of injury. What is the number one injury for nursing? Anybody know?
Hurting your back.
Backaches.
Say again. I didn't hear you.
Back in.
Back injuries, number one. And what's the reason for most back injuries?
Bed being too low. When they get
Yes.
Right, poor body mechanics, right? We're rushing, we're trying to do things and maybe not following the best body mechanics. And so with these occupational health nurses or programs, right, the goal is to kind of make sure that, we're identifying any potential hazards, as well as, finding ways to prevent them to happen. So nurses function in a variety of roles within the workplace settings. And we're challenged, I guess, to provide cost-effective, high-quality care to our patients. And so as health nurses, they are going to develop partnerships with workplace administration, safety specialists, occupational medicine, physicians, HR, health insurance agencies, all of those things. And so some of the things that they are going to do is assess risks for work-related illnesses and injuries. They also will plan and deliver health and safety services to the workplace. They will even collaborate with community health providers. And then, of course, your health promotion activities. And so occupational health is something that nurses can do. And like I said, it's a variety of different settings, because no matter where you go, there are going to be potential hazards. So the OHN, or the occupational health nurse, clinical educators, they're case managers. They also provide counseling and crisis intervention, health promotion, risk reduction, legal and regulatory compliance, as well as that wonderful hazard detection. So what are some potential hazards that we have in healthcare?
We have like biological hazards.
Okay, biologic, infection, disease. Okay. We also have, the physical factors as well. What about some of our medications? What are some medications that are potentially hazardous?
Chemo and radiation.
Chemo and radiation, right? So those are some things that we need to, look at when we're working with patients that are, with nurses that are working up on the oncology floors or down in radiology. What are some other hazardous things that we're exposed to? I mean, I know it maybe sounds simple, but infections, disease, what about noise? What about the lighting? Needle sticks? Yes. What about stress, burnout, violence? Those are all things that we have a potential to be exposed to within aggressive patients. Yes. And it's not always just the patients, right? We may have to deal with upset family members, right? That could potentially put us in harm. Stress. What about addiction? That could be a potential issue with, some of our nurses as well. So there's a variety of things that, workers are exposed to. And so when we look at the primary, tertiary, and secondary, or primary, secondary, and tertiary prevention measures for occupational health. So prevention, teaching coping mechanisms, healthy diet education, ergonomics. Has anybody heard of ergonomics before? No. It's your body mechanics. It's very similar. Making sure that we, lifting the bed up to our working height, right? That we're not bending over. We're not trying to reach above our head in order to do things. Protective equipment. What type, have proper ways to use your personal protective equipment and other, equipment that is on the units. So, think of your precaution patients and making sure that we're using those. Occupational health also will provide information on immunizations. So making sure that, the nurses and other members of the organization are receiving the immunizations. Secondary prevention, right? This is your screening. So secondary would be looking at any workplace hazards. We can do early detection through health surveillance and screening. So your hearing loss, blood pressure screening, screening for stress and burnout. They can also do some counseling and referrals to try to help prevent any further limitations. And then tertiary is treatment, right? So let's say somebody gets hurt on the job, whether it's a needle stick, whether it's, think of somebody that may have been exposed to tuberculosis, or somebody that had an injury on the job, right? This is our limited duty programs for workers that are recovering from injury or illness. We can also provide, illness or injury specific education, such as the use of wrist splints for carpal tunnel, the use of back brace for back pain, back issues. A long time ago, just as an example, kind of silly, but I worked at the time I thought it was silly. I worked for an insurance company, okay, as a managed care nurse. And primarily you sat in front of a computer all day, and we did have some, phone conversations with clients, but very few. Most of it is literally just sitting there at a computer. And we had to do ergonomics training online. And so this basically told you how to set up your workstation, right, to prevent back and neck strain, try to prevent carpal tunnel. So these are all programs that would be part of occupational health. And those are your different types of screening. Other things, when we look at occupational health, they can also go and they can do walkthroughs of the units to see, what's working like on the unit, looking at work processes, and what materials are there, what are the job requirements of those that are on the unit, and looking at any actual or potential hazards, also looking at their work practices, like your hand hygiene, waste disposal, what else? Housekeeping. I know a lot of times too, we think of educators, right, would do some of that as well. But if you look at, their job is to promote health and to prevent sickness or illness. So it's kind of, part of their job to do those site walkthroughs. They're also going to track. So, how many needle sticks are there? How many exposures are there? How many injuries are there? And they are going to track those and try to, see if there's a pattern of, behaviors and things like that. And then they're going to look at ways to prevent, exposures and things. And then when we look at violence, what do you think are, I'm almost afraid. No, I'm kidding. What are some stressors in healthcare? What are some stressors in healthcare? What do you think are some stressors for nurses in healthcare?
Workload.
Workload. That's usually the number one, right? Is workload. What else?
Shortages, people calling out, not enough nurses on the floor.
Right, working short-staffed. All right, working short staff, picking up extra shifts, or what about not having the supplies, and other things that you need in order to do your job, right? Those are some things that could increase stress. And so, these are things that, need to be identified. They need to be looked at in order to try to prevent them from occurring. And so these are all jobs who are the occupational health. Who's heard of OSHA? Nobody's heard of OSHA? Occupational Safety and Health Administration. And so those are some of the legal and, regulatory compliance that occupational health and other, facilities have to follow. And the goal is it's to provide the safe working environment for employees. Other regulatory compliance, of course, would be HIPAA. Who's heard of FMLA? Family Medical Leave Act. And so those occupational health nurses are going to work with all of those organizations, to make sure that they are in compliance with regulations and the laws that are affecting the workers as well as the workplace. And OSHA's got, some nice laws, rules, and regulations that healthcare or any facility have to follow in order to provide safety for the workers that work there. When we look at environmental health, what do you think environmental health would look at? Think about your environment. What is some things in the environment that we would want to look at?
Pollution.
Okay, pollution. So air pollution, water pollution, right? So very good. So environmental hazards are responsible for half of the total burden of diseases, and contribute to 80% of communicable and non-communicable diseases and injuries worldwide. So not just here in the United States. Children are obviously going to be more vulnerable to environmental hazards, and those are more likely going to lead to more adverse health outcomes, especially during the fetal development. And then as a child, they, are going to be much more vulnerable. We look at environmental health, it's determined by genetics, socioeconomic status, environmental exposures. Why do you think socioeconomic status affects environmental health? Or areas of living. Okay. So those who live in poverty, they may have homes that still have that lead-based paint, right? Homes built before 1978 may have lead-based paint. So people that are living in those homes are going to have that lead exposure. They also may be lead in the water piping. Asbestos may be something that they are exposed to as well. They may be more likely to be exposed to environmental hazards because of crowded living conditions. They may live closer to hazardous waste, have poor quality foods available, may have more hazardous jobs. Even, if you're in an older community, the schools, the daycares might be older as well. So these are things that with those lower socioeconomic status may have an issue. They may become an issue. What about genetic predisposition? How do you think that plays a part with environmental hazards? Yes, very good, Melissa. So family history of non-communicable diseases is that are linked to environmental hazards, may have a history of developmental delays, autism, asthma, eczema, things like that. So there is some sort of a genetic, there is a genetic predisposition as well. Yes, and in the more polluted areas, rent and the cost of living is lower as well, right? And so those are things that we have to take into consideration. So when we're looking at the environment and we're doing an assessment of the environment, We want to look at where people live. Anybody watch the movie, Aaron Brockovich? Right? So we know that, why can't I remember? I can't remember where it is now. But that is a true story, right? At Flint, Michigan. And so there is still, consequences of that where they had, what was it? It was some sort of it wasn't radiation, it was some sort of water, it was water pollution from a
Yeah,
factory.
that's what
Um,
I remember it being water pollution.
I can't remember what the substance was. It was some sort of radioactive substance. I do know that. And it was causing a lot of illnesses with adults and kids in the area. And so this is, and it's, like I said, it is something that still continues to this day. I know some of y'all maybe are a little bit younger, but we also had the nuclear reactor breakdown or incident in Russia, you know, and so there's a lot of, issues that are coming from that as well. So when we look at environmental health risks, we have to look at where they live. We also have to look at where they work. What are some, environmental risks with some of, we talked about healthcare, but what about other places where people work? What are their exposures? So we talked about migrant workers, maybe there's pesticide exposures, and other types of things. We talked about lead, people that, even, I don't know what they're called, right? But the companies, that can, you can go and get your car painted, right? There's, solvents and things like that that they're exposed to. Your co-workers, your factory workers, looking to see what they're exposed to. What about in the air? What are some things that we look at in the air?
Pollution.
Okay, so pollution from factories, cars, um, aerosols, even tobacco smoke, right? I always feel bad. Of course, you fuss at that, you're fussing because you're stuck in traffic when they're doing construction, right? But think about your construction workers on the side of the road, working on the road, right? And all of the fumes that they are exposed to on a daily basis, right? So these are things that we have to look at when we're looking about where people work. What are they doing? What is their exposure? Um, Dietary history. So what are they eating as well, right? So, there's fish that are high in mercury. We also have, pesticides that may be present on some of the fruits and vegetables, right? That if they're not cleaned properly before eating them, your GMOs, the antibiotics that are in our foods, right? So these are things that we have to look for as far as diet. Who's heard of a windshield survey? Anybody heard of a windshield survey? Nobody's heard of a windshield survey?
Not until the quiz.
Um, so what do you think a windshield yes,
where
you
you're
have to do
sitting?
one for your project.
Is that
So-
where you're sitting and then observing like someone in your community around you? Like you're just watching.
Yes, so a windshield survey is literally getting in your car and driving around. Yes, you have to do it for your project. That's due in week 10. So yes, you're literally going to get in your car and you are going to drive around and you are going to look at a specific community. And so, you're literally, like I said, you're going to drive around in your car and you're going to look, you make sure that you have very well-defined borders, and you are going to look at all of the, dimensions. You're going to look at the demographics. You're going to pick your vulnerable population. You're going to see what is available in that area. Where are the daycares? Are there food banks? Oh, and so, you're gonna, look at, what are the schools look like? What are the playgrounds look like? And that is what your windshield survey is. So yes, you are going to drive around, you are gonna look. You look, are there factories? Are there dump sites? What's the transportation availability, right? Is there public transportation? Is it buses? Is it trains? Whatever the availability. You want to look at the age and the conditions of the housing in the area, right? Is it mostly older housing where we could have potential lead and asbestos exposure? Trash exposure, what do the yards look like? And then if you're in a more rural area and we look at like the pesticides, do they use like crop dusters, right? To spray pesticides or even, watering and things like that. So, that's going to be part of that windshield survey. And of course, it depends on where you're living and where you're doing your survey. Like if you're in a more rural area, maybe what's the access to healthcare, and preventative services, right? Generally speaking, in those rural areas, it's going to be declined because it's, spread out. Pesticides are used everywhere. They're used at home, right? We use them at home. We use them in schools, daycares, hospitals, lawn care, farms. So pesticides are there to try to get the pests to go away. And so even with the farms, again, there's going to be some that is left in our food. And so childhood leukemia is associated with prenatal exposure of parents to by pesticides at work. So think about, what that is going to, what are the potentials for that? What else? Drinking water. So the quality of your drinking water, pollutants for water, it could be the result of wastes. Could be, runoff from chemicals getting into the water. And so, most of our fresh water is groundwater. So think about too, what's in the soil. One of the things that, and this was a long time ago, but when I was in my bachelor's program, I got to spend a day. They were occupational health nurses. They worked for I don't know if actually, I'm not going to say that they were occupational health nurses. I don't remember their titles. But they worked for the health department, and one of their jobs was to go into more of the rural areas where they didn't have like city plumbing and city water, so they had to have wells set as well as septic tanks. And so part of their job was to go out and assess the land, looking at any elevations in the land, right? Because obviously if we're setting up someone's house and we are putting a septic and a well in, we want the well, right, to be higher than the septic, because in case something happened with the septic tank, we don't want that to contaminate the well water, because obviously that would lead to, disease and illnesses. So I thought that was pretty cool. Didn't even know that was the thing until I actually went to the health department and, spent the day with them. And so, just looking at that, but then we have to look at the factories and other issues, how close are they, to our water supply, any waste products, kind of like what happened in Flint. And Flint's not the only area that is going through issues with that. But it was made popular because of that movie. But then with the soil too, you have to look at what are we adding to the soil, right? Get that nice, everybody wants the nice green lawn, right? So are we adding a whole lot of pesticides, or not pesticides, fertilizer to our lawns? What impact does that have on getting into the water? It also water is also contaminated by antibiotics and hormones in our meat animals. Dumping by industries, talked about that. What about runoffs from our paved roads and our parking lots, right? So those are things that we have to look at as well. With air quality, motor vehicles are going to be the #1 source of air pollution, followed by the burning of fossil fuels. So the diesel, the industrial sized boilers, power plants, and then waste incineration. And what are some of the diseases that are associated with poor air quality? Shortness of breath, asthma. Okay. So other things, it also is associated with cardiovascular disease, the development of certain cancers, reproductive health problems as well, including birth defects. It also can be neurologic. What are some things that we recommend in people's homes to monitor for air quality?
Isn't it a carbon dioxide detector?
Very good, a carbon monoxide detector, right? And so people, I don't know if anybody has heard those stories where people just, they don't have the carbon, monoxide detectors. Maybe there's a small gas leak, right? And they start complaining of headaches and dizziness and not really feeling well, which eventually, if not fixed or corrected or identified, right, could definitely kill somebody. What are some other pollutants in our house that are in people's houses that we need to worry about? Think of things you do every day. Cleaning.
Cleaning products.
Yeah, cleaning products. So any of those chemicals that you are using, anybody ever used Easy Off to clean their oven? That stuff, man, it feels like it just burns no matter how much you try to protect yourself when you're using that. But it even can be anybody use like aerosol hairspray, aerosol deodorants, right? That can also get into the air. And then of course your dust mites, molds, pets, right? We all love our pets, but they have dander, they have hair, right? So that all can affect the air that we're breathing in, as well as anybody tobacco smoke, whether it's cigarettes, cigars, pipes, that kind of thing. And then with our food, again, just to reiterate, the pesticides, the hormones, the antibiotics, right, can also be some food contaminants. What are some pathogens that are present in food, that are potentially present in food?
Salmonella from chicken.
Salmonella from chicken and eggs. Yep. What else? So, yep, E. coli, absolutely. E. coli is mostly in your beefs or your greens, right? How many times have they had like lettuce recalls, right? Whether it's lettuce or what's the other one? Romaine, right? Where they've had E. coli, salmonella, right? Making sure that when you're cooking, they're cooking their food and handling their food properly, right? I was, when I worked in pediatrics, we had a child come in really sick, nausea, vomiting, extremely dehydrated. Um, couldn't really, first we thought maybe it was a viral thing. Ended up getting some blood work done, and sent his stool for culture, because thought maybe he even had C. diff with just the amount of stool that he was having. And his came back with salmonella, but it wasn't from chicken. The Komodo dragons, like those pet reptiles, I don't know if it was a Komodo dragon, but like a lizard type thing, also carry salmonella. And so the parents had let the whatever it was, like walk on the counters and stuff like that, and didn't wipe the counters down when they were preparing food, and the child got salmonella because of their pet. So, these are things that we have to look at too when we look at, what type of animals are in the home. Oops. So again, how do they handle their food? How do they prepare their food? How do they cook their food? These are all very, important questions that we are asking, them about. And then what animals and pets that are living in the house. Education. So with education, a lot of what nurses do is provide education to our patients. And so as practical nurses, right, our goal is going to be to reinforce the education that it is, that is being provided. So we educate to promote health, to prevent injury and illness, to improve health-related behaviors, enable patients and their families to care for their health conditions, right? And, the more they know, right, the better off that they are. And so when patients take responsibility for, their health, they are more effective at making change, and maintaining. It empowers them, right? Education empowers, right? The more you know, the better off that you are. And so, like I said, one of our primary goals is education. And so reinforcing that education to our patients is super important. One of the most important learner-related behaviors is what we call low literacy. What is low literacy?
Like the ability to understand, I think like what you read and stuff and comprehend.
Okay, ability to read and comprehend. There are still plenty of people here in the United States that cannot read and write and don't understand written word. And so we have to, assess their literacy level in order to provide the appropriate education. A lot of people they may feel embarrassed, right, about, admitting, that they can't read or that they don't understand. And so, they may appear or they may try to appear that, nod, shake their head. Yes, I understand, right? Say all the things that we want them to say, but truly do not understand. And so that is something that we do face. And so one of the ways that we can assess their ability to read and comprehend is having the client read printed instruction sheets, and acknowledge, that some people have different, difficulty with that. Just if, even, they graduated from high school, it doesn't mean that they can, that they have reading comprehension. And so allow, if they read it aloud, that helps us to know if the patient can read as well as comprehend. What about cultural values? Where is that going to fall up into with learning?
Different cultures have different ways of learning and teaching.
Okay, so they're going to have different ways of learning. And we can even break that down, you know, um, what's the best way for us to learn about somebody's culture or a culture that is not ours?
To ask them questions about their culture.
Ask them questions, right? And so asking them is going to be extremely important. What about language? If I have a non-speaking client, what is the number one way, or what is the number one recommended way to work with that client?
Interpreter.
Right, getting a professional interpreter, right? Don't use family members or children unless it's an absolute emergency, right? We're going to get that interpreter. If my native language is not English, am I going to provide instructions in English? No, right, Marion? We're going to provide it in their native language, right? That is the best way for them to understand. Who's anybody here whose first language was not English?
Yeah,
So what language do you think in?
French.
French. So when you are taking tests or reading things that are in English, right, you have to translate it, right?
I'm
But-
French, and then I understand better in English.
right? And so, right, so we have to look at these things, and they may speak English, but if their native language is different, it's going to be still going to be harder in some cases for them to understand. So we want to make sure that we are providing them the education in a language that they understand. And it's not just language like, as far as English, French, German, Spanish. It's also, do we want to give them education with a whole bunch of medical terms and big fancy words and things that general people are not going to understand, right? So we have to look at that as well. Making sure that we're using a language that, it's easy to read, it's easy to follow. Other barriers, readiness to learn. Motivation plays a huge role in effective learning, right? The desire to return to independence or to return to comfort of living is usually the motivating factor. And so working with those patients to show the advantages of learning what they need to know will help them. But if you go and let's say you have a newly diagnosed diabetic, then we're trying to provide education on, glucose, checking their glucose levels. And then we have to teach them about diet and exercise, right? And how to give their insulin or take their medication. If they're upset, they haven't really, made any kind of acceptance, right? they're less likely to be receptive. We have to try to show them how it's going to benefit them in order to increase their motivation. You get a new diagnosed patient with a chronic disease, right? They're going to go through those stages of grief, right? And eventually come around. Other things, if the patient is comfortable, rested, there's minimal interruptions, right? Our education is going to be more received. When does discharge planning start with our patients?
Day of admission.
Right. As soon as we admit somebody, that's when we are going to start everything that we need to do to get them ready for discharge, including all of their education. What about lack of self-confidence, right? That's another big part of dealing with somebody when we're providing education, right? Think about someone who has to get a new colostomy, or even about a newly diagnosed diabetic, right? That's a lot of fear. Like, oh my gosh, I'm not going to be able to take care of myself. I'm not going to be able to change my own colostomy bag and check my blood sugars and monitor my diet and give myself insulin injections, right? This is also something that we have to look at as well. And so, we want to make sure that, we're identifying those feelings, then we are trying to find ways to enhance their self-esteem, to build them up so that they feel comfortable performing these things. You have to be really careful. You make sure that we're using praise, we're using encouragement, not overly doing it, right? But we want to continue to praise and encouragement, right? So that we can get them to a level where they need to be at. And then, culture and values. Also, we have to look at that too, because those cultural values are maybe different, right? And so there may be things that we, may have to address regarding diet and exercise, and other things, right? Depending on how they feel about how they got sick and why they got sick. And so we have different ways of learning, right? Your cognitive, your affective, and your psychomotor, or your visual, your auditory, and your kinesthetic. What is cognitive? What is cognitive learning? Reading, yes. This is the thinking part, right? You're able to hear, you're able to read information, understand it, memorize it if need be, and then use it later, right? So think about some of your nursing topics, right? You read it, you understand it, you can memorize it, and then you go to take that test, right? You can answer the questions on the test. What is affective? Affective domain. What is affective? Higher thinking, functioning, abstract thought. So affective is the feeling. How do you feel about it? Okay. The person's attitudes, their feelings, their beliefs, their values, that's affective. How is it going to affect them? How did they perceive the situation, and how is it going to fall into their feelings, their beliefs? And then psychomotor. What's psychomotor? What's psychomotor? The psychomotor, that is the hands-on, right? That's the moving part, where we learn a skill through practice and teaching, right? So you go into the skills lab, right? And you learn how to perform a skill. And so with that, we have visual learners, auditory learners, and kinesthetic learners. Who are my visual learners? Raise your hand if you're a visual learner. All right, who's an auditory learner? Couple. Who is my kinesthetic learners? Okay, and then who's a combination? Me too. And so when we provide education to patients, we have to use a combination of all of these, right? In order to make sure that we're meeting all of those domains. I am all three myself. I like to see it, I like to hear it, and I like to do it all, hope not always at the same time, right? But using a combination. If your education doesn't address all three, you're not going to be as effective. If you're telling someone to change and you're not motivating them or providing them the skills necessary, it's not going to be effective. And so when we look at reinforcing, so again, LPNs, we are going to reinforce education. So we are going to collaborate both with the patients, the staff. We're going to develop that education plan. And so that patient or the education plan should be agreed upon. It should be discussed, and making sure that we are addressing knowledge deficits, with dates as well. It should be dated so that we have something to reference back to. And then whoever's providing education, because it's going to be multidisciplinary, right? So think about our diet, our newly diagnosed diabetic, right? Nursing is going to provide education. The dietitian may come in and provide education. The endocrinologist may come in and provide education, right? So it's not just one person, it's going to be a team. And so the ultimate goal of education is prevention of illness, promotion of wellness, restoration of health, right? So, a lot of it is just it's empowering the patient, giving them as much information as absolutely necessary, so that they have everything they need to take care or learn to take care of themselves and their disease. And we talked about discharge planning, right? That starts at the beginning. It starts from the day of admission. And so we're looking to meet that patient's ongoing needs once they go home. And so, we're looking at what their special needs are, and then providing education and learning moments. And that helps us to prepare them for what their needs are going to be, right? So it's not just it's education, but what are they going to need? What are their needs going to be at home? So even think of like, do they need oxygen? Do they need, other durable medical equipment to go home with? Making sure that they are getting all their prescriptions and all of that information. So when we look at prevention and education, with primary is prevention, right? Secondary is screening, tertiary is treatment. So primary, teaching, anything that we're teaching, right? Teaching about healthy nutrition, education on immunizations, teaching women to void before and after sex to prevent bladder infections. Secondary, right? Teaching elderly about the signs and symptoms of UTI, education on preparation for colonoscopies, pamphlets on the importance of and scheduled pap smears. What else? Tertiary, teaching low sodium diet to a patient with hypertension, right? How to use a glucometer. Pamphlet with the signs and symptoms of hypoglycemia and how to treat for diabetic, potential side effect of medications. So basically, learning hasn't occurred until the behavior has changed. And so behavioral changes are going to be the hardest, right? Because we want to go more towards the path of least resistance, right? And most people are very resistant to change. And so, right, that's where we have to see how is this going to affect them? How can we get them to change their behaviors? And that's usually the hardest part. Think about a, a 72-year-old man that has just come in and he is a newly diagnosed type 2 diabetes, and we have to tell him or teach him, right, about all the necessary dietary changes that he is going to have to make, right, now that he has been diagnosed as a diabetic. Do you think that is going to be something easy for him to do? How difficult do you think that is? Think of the things that, we do on a daily basis. And we, ask, we have to, because of a disease process or, something else going on in our lives, that we have to make significant changes. Significant lifestyle changes are not easy to make. And so, especially in those emergency situations, they, you're giving them a whole ton of information about lifestyle changes, about other changes that they are going to have to make. And so again, can be very difficult for them to make those decisions or make those changes. So we have to, teach them how this is going to be beneficial to them. Again, education is empowering to them. So the more they know, the more, able that they are to make those educated decisions about the things that they need to do in order to, live with that chronic disease, and try to prevent any of the, issues that can arise from those diseases. All right, any questions? Because I want to go back to our week 10 project real quick. So I know a couple of you have looked at your week 10 project. Who has not? Well, I don't know if anybody's not going to tell me if you have or not. So let's talk about the week 10 project real quick. So the project is to select a vulnerable population in your community. And so out loud, tell me, what are some vulnerable populations?
Substance abuse,
Okay,
Homeless
substance
people.
abuse, homeless,
teen pregnancy,
Veterans.
veterans. Very good. The elderly, right? So if you live in
Older
an
people.
area, yeah, if you live in an area where there's a high population of elderly, right, they're a vulnerable population. All right. And so if you don't know, okay, about a vulnerable population in your area, all right, what you can do is what you're going to do is that windshield survey. So you're going to provide, a clear, defined lines. All right. So I'm going to use Norfolk because lived there for 30 years. So, right, you want to make sure that you stay within your city limits. Okay, so you're going to, look at a Google Maps, whatever it is, and you are going to identify the city limits, because you don't want to go outside, because then you're crossing out, and then drive around the area and we'll look at what you see. So if you're looking at the homeless population, you want to identify that, the veteran population, the elderly, the drug users, whatever the population is. And then you are going to identify that vulnerable population. You want to identify health risks, okay? So not actual health. We're looking at health risks. What are the health risks for that population? What are the needs of that population? So if it's, what do you call it? If it's a homeless person, okay, health risks, right? Exposure to elements, tuberculosis and other communicable diseases, malnutrition, whatever, those are, some of the health risks associated with the homeless population. then you want to look at what are their needs. So when you do that windshield survey, if you're focusing on homeless, where are there food banks? Are there free healthcare clinics? Like what are the, what are the resources available for, what are their needs, and then identify those resources, right? And so you want to look at the different resources available. And then when you identify what's available, what is missing? Okay. So, maybe they have homeless shelter, but they don't have food banks in the area, right? So that's kind of what you're looking at. So you're looking at the available resources, and then you're looking at what is missing. What are some additional resources that could be used in that area? And then any service gaps and interventions that you could be used to fill gaps, and that's your primary, your secondary, and tertiary. So this is a PowerPoint presentation. It's not a paper. So, when you're looking at that, so that's kind of what the whole premise is for that. Does that make sense? A little better understanding. Does anybody have any questions about the project for week 10?
Not about that one, but the
Okay. About what?
the group project. So is it due this Sunday or the following Sunday? Because a lot of people had questions regarding what week 7 Sunday meant.
Okay, so the infectious disease project is due the 28th. No, I'm sorry, the 21st at 11:59. So
Okay, so it is due on Wednesday.
I'm looking at it.
Oh,
Yeah, the 21st is a Wednesday.
I know, because the email we had received, it was kind of confusing because it said not on Wednesday, it said Sunday. So I don't know if we were supposed to submit it Wednesday or we supposed to submit it Sunday.
So when's May 28th? Let me look at mine.
It's Wednesday. It's the following, not the one coming up, but the following.
So Miss Marvel put it in as the 21st, and that's what you guys had. So I'm not going to change it. Okay. So yes, it will be due the 21st. It should technically be due the 18th, right? Because it's due week 7. So no. No, it should be due the 25th. Right? Okay. I will change it. It is not due until the 25th. Because that would be the end of week 7. So let me. I'm not sure why it was put on a Wednesday. All right. So I changed it. So it's due on Sunday, the 25th. Okay. Thank you for pointing that out to me. All right. Any other questions? Nope. All right, guys. Well, it's a pleasure. There's one exam review posted. There's another one this evening. There's another one tomorrow if you can make them. I didn't have anybody come to mind, so that's why I don't have one posted. If there's attendees for the one tonight and for tomorrow, then I will post those links as soon as I have them. All right. All right. Well, you guys have a great week, and Scranton, don't go anywhere.
I'm sorry, you said what time is the review tonight?
I have to look. Let me see. Today is the 16th. 6 p.m. So you got 20 minutes.
Okay, thank you.
You're welcome. It's with Miss, who is it? It's Miss Marvel that's doing the one at 6.
Okay, thank you.
You're welcome. All right. Great. So I have everybody from. All right, so let's see. I have Dakota. I have Michelle. I have Kiera. Sometimes I wish y'all would pop up in alphabetical order and make my life easier. Kiera, do a Marion. Marion, yes. And Brittany and Russell. All right, awesome. So. All right, so the password is Marvel, just like it was for the quiz today. And just let me know if you have any issues getting in.
It says it's locked for me.
Same.
Okay, let's see. Let's see. Oh, I think I know what I did. Okay, now try.